as we're talking, there's another thing that goes into a good case too. A good outcome is the patient care after the surgery.
Yeah.
Right. I always tell people what I do or what we do is like sending somebody across on a road trip across the country with a Fabergé or something expensive that's fragile across the country, and you're just saying this is how you need to package it, but you're just trusting that they package it and transport it across the country that way.
Yeah.
And that's very much, what we have to live with is we give them a special diet. We give them special instructions. Do they ice afterwards? Are they going to be compliant with meds? Just a little anecdotal thing. Like my grandfather's getting older. He's got congestive heart failure, and he has to be on a lot of medications. And he takes like half of them on a whim of what he wants to take. And just looking at that, and I consider him to be like an intelligent, good dude. And even he's only taken half of them. So trusting that a patient takes their medications, takes care of the things correctly, those things all set you up for success. And, it can be frustrating when you have a patient that's non-compliant.
Yeah, for sure.
Because we're not going to we can have inklings of maybe they've been smoking, maybe they didn't ice, but we can't call them out because what if they did and they're just a unique outlier?
It's really hard to know, but patients, again, being open to taking your advice and, if they have questions, asking the questions, but reading the instructions, it's not there just for fun. It's there to help you out in the long run, but it's not just like you're going to be offended. It's their investment. So I would say, again, I always say 99.9, but it's true. I think majority of our patients take that time which is a great thing, to learn how to properly clean. I'm sure you'll go over that on another episode. And I know patients have questions on that, but like, how do I maintain this? So patients being willing to ask the right questions and know that this isn't just like a quick fix, like they have to take care of that is important.
Yeah, the openness to the education is important.
Yes, for sure.
And we've been very intentional about making sure that every word on that piece of paper is there for a reason, knowing that not everyone's going to follow it, right? That we know not everyone's going to do everything we want them to do.
Yeah.
And that's okay within reason, but if anything, we over-prepare our patients for what to do and how to handle things because we want that to be, if the average is 50% and it still works, we want them to be 85% and it works that much better.
Yeah. I think we say the same. I know myself, same pre-op instructions. And I even tell patients like, hey, I'm sorry. I think I'm annoying. I feel like I'm annoying, but I want to make sure that you are prepared and you have everything you need prior. I don't want you scrambling the day of surgery. I want you comfortable because, again, that's going to make their experience that much easier.
Right.
So I think it all goes back to just patients being open to asking questions or, listening to, again, you've done it how many years? Like, you know all the tips and tricks of what'll keep them comfortable.